Welcome to an hour of HealthMade Radio. HealthMade is a community for natural health seekers where we educate people about common health conditions and share extensive research on the most effective natural health treatments and promote legislation that protects our health freedoms. A core concept belief is in the innate intelligence and healing power of the body, and if properly supported spiritually, emotionally, and nutritionally, it can find its way back to health. HealthMade Radio will bring you information from integrative health experts throughout the world. Check us out at healthmade.co. Health is what you make it. I'm Dr. Michael Karlfeldt, and I will be your host. Today's guest is Dr. Dana Ullman. Dana Ullman, Doctor of Homeopathic Medicine, is widely recognized as the foremost spokesperson for homeopathic medicine in the U.S. His newest book, The Homeopathic Revolution, Why Famous People and Cultural Heroes Choose Homeopathy, is a scholarly research and popular written book that confirms that many of the most famous people and cultural heroes of the past 200 years used, appreciated, and or advocated for homeopathy, including 11 American presidents, 7 popes, Charles Darwin, Mother Teresa, Tina Turner, and many, many more. The physician to Her Majesty Queen Elizabeth wrote the foreword to this seminal work. Dana Ullman co-authored America's most popular homeopathic guidebook, Everybody's Guide to Homeopathic Medicine. He's founded Homeopathic Educational Services, America's largest publisher and distributor of homeopathic books, tapes, software, and medicine kits. So, why homeopathy? What brought your passion into that area? I mean, obviously you can go in any direction, but I mean, you've really taken the reins and kind of guided homeopathy here in the United States. So what brought you that passion?
Well, it's a little bit karma and magic, but ultimately, my father was a physician, a pediatric allergist, and allergy, of course, is that medical specialty of using small doses of what you're allergic to. It's not that that's what woke me up to homeopathy. That didn't. I just happened to be going to school at UC Berkeley, and being a child of the 60s, I was exploring various alternatives. I got introduced to homeopathy by a friend giving me a book, and it sounded really interesting. And then a year later, a Stanford-trained physician and a male midwife were deciding to create a study group of professionals to study it together and then practice and then share experiences. And that group of people became 3 doctors, 2 nurses, 2 yoga teachers, a dentist, and several lay people, and we met weekly over 5 years. And at different times, people began practicing. It caught my attention and my passion because homeopathy is a highly systematic system of prescribing these nano doses, these really small doses of natural substances. And it's not according to the disease the person has, but more the way they have their disease. Because ultimately, when you think about it, your headache and my headache may have some similarities, but there'll be many, many more differences. I mean, you may have it in the front part of the head, I might have it in the back. You may have a cough with your headache, and I may have dizziness with mine. You may wake up with it. I might have mine in the late afternoon. You might feel good putting pressure on it. I can't stand any type of touch. So, to say that we both have a headache, that's the diagnosis. At the same time, the way you have yours is vastly different than the way I have mine. And it's just really unscientific thinking. And conventional medicine prides itself for its science, but so much of it is really based on jello, where it's simply not as scientific as it would seem. And then, of course, according to statistics in terms of who is prescribed what medicines, on average, every man, woman, and child in America is prescribed around 14 different prescription drugs. That doesn't even count all the over-the-counter drugs. And there's been no research about how these drugs interact. They can work together well. They can work together badly. They can be dangerous, both with short-term and or long-term effects. But the ultimately thing that really caught my attention is that in homeopathy we have a strong belief in evolution. And believe it or not, doctors only give lip service to evolution. Because if you really believed in evolution, you'd realize that disease is not simply as the result of breakdown of the body, but actually our symptoms, our fever, our headache, our pain, our high blood pressure, our different emotional states are all efforts of our body-mind to survive. We create that fever to burn out an infectious organism and to create an internal environment where the body secretes naturally this antiviral chemical called interferon. And the whole variety of other symptoms, even high blood pressure, is this adaptation process. And it's in its effort to survive longer. And so instead of using medicines that suppress a symptom, and that ultimately may provide a temporary benefit of getting rid of that symptom, which is great. But it's temporary because it's not really healing it, it's simply suppressing it. So that the condition may go away, but then a month or 2 months or 1 year or 2 years later, a much more serious condition arrives. And from a homeopathic point of view, this is why we're getting and seeing so much more chronic illness at younger and younger ages, while there's much more immune problems, while there's more neurological problems, while there's more psychiatric problems, while there's more dementia. We've turned acute ailments into chronic ones and into systemic ones. So ultimately, instead of suppressing symptoms by using a medicinal agent, this is the thing that's unique about homeopathy. And the word homeos is a Greek word which means similar, and pathos or pathy means disease. And the idea in homeopathy is to use a substance from nature that would cause in healthy people the similar symptoms that the sick person is having. And I don't mean that, we use thousands of different substances, and there's, different substances that cause different skin rashes and other things that cause headache syndromes and other things that cause cramping and other things that cause, irritability and or hyperactivity or fatigue or whatever. And by cataloging in detail what each substance on the face of the planet is known to cause, then when we interview a patient in homeopathy, we look to find a medicine in nature that would cause in healthy people the similar symptoms this person is having, because these symptoms are defenses. These symptoms are the way their body and mind is trying to survive and adapt to the variety of different infective agents, stresses, nutritional problems, and psychological stresses. So, this is, to me, what's a spiritual side of homeopathy is to see our symptoms as not a problem, but they're the effort of our body to create a solution.
Yes, to recognize the intelligence of our bodies and listening to when it's communicating, like you're saying, instead of just telling it to be quiet and we're just suppressing the symptom by Tylenol or some anti-inflammatory or some antidepressant or steroid. We are then relishing the communication from the body and really then try to use, like in homeopathy, then you're using something in a minute dose then to stimulate the immune system or stimulate the body's ability to trigger a response to whatever is causing that symptom picture.
Absolutely. And it's intriguing to note that vaccines derive from homeopathy. Homeopathy was around using even much smaller doses. And we don't always use the medicines in the same way that the vaccines. We certainly don't inject them into a person's bloodstream. But the idea in homeopathy is that it is the most sophisticated system of toxicology on the planet. In other words, we have in our textbooks called Materia Medica which are Latin words for the materials of medicine. And in these books, it details out what different plants, minerals, animals, or chemicals cause an overdose. And so now we use expert system software that, once the patient tells us that they have a headache in the front part of the head, and that it is worse when they move, and it is worse by light, and it is worse when they wake up. And that alone, these couple symptoms begin to narrow it down from several hundred to several dozen. And then as you interview the person more and you find out more unusual and idiosyncratic characteristics of this person's health, you then find a medicine that really is much more individual to them. And whereas these nanodoses, these very small doses, will not have any effect unless that person's symptoms happen to resemble that substance's toxicology. And then our body has a literally radar, hyperactive sensitivity. And these nanodoses, and the reason why they're able to have such a significant effect, is that these nanodoses are able to penetrate cellular membranes and blood-brain barriers with much greater ease than large doses, because large doses of a substance will certainly lead the cell to lock down its membrane, because a membrane is just that. It's a membrane that lets certain things in and doesn't let other things in. And when it's at such a low dose that it doesn't set off any alarms, it's able to penetrate into our body and mind. And then of course, our body and mind does have hypersensitivities. And then the mind realizes we've been infiltrated by arsenic. How do we get rid of arsenic? And because the person's symptoms resemble that of an arsenic poisoning, it creates this immunological response of the body that in the process, the person gets noticeably better.
That's fascinating. We're going to take a quick break. You're listening to HealthMade Radio. I'm here with Dr. Dana Ullman. We'll be right back. Welcome back to HealthMade Radio. I'm Dr. Michael Karlfeldt. I'm here with Dr. Dana Ullman. That philosophy of the nanodosing and how it's able to then penetrate the cells because it's such a small amount and they're so tiny, so they're able to get to places without the body then mounting a defense until, like you're saying, it recognizes that all of a sudden it's in the cell. You got arsenic in the cell, or you got mercury, or whatever it may be, and then it will mount then the immune response or the response as if they were poisoned by that substance, and that will then match the symptom picture, to generate the energy within the body to help to heal it from whatever creates those symptoms.
Right.
So I'm curious about, because the issue of vaccines obviously is a huge, it's a big deal, in regards to all the garbage that comes along with the vaccination, the high levels of different heavy metals and formaldehyde and so forth. And so how is that different? I mean, how is that dangerous versus an homeopathic? If you do like a vaccination of homeopathy, you take something to support you against measles. I mean, can you do prophylactic like that, taking homeopathy against the disease?
Yes, you can do prophylactic homeopathy, and one of the ways that people do prophylactic homeopathy is every winter time or late fall. We get in homeopathic doses of a medicine called influenzinum. Influenzinum is the same three flu viruses that are in the flu vaccine. And that changes every year according to the Pasteur Institute as to which are the most common flu flu viruses that are proliferating on the planet. And then they make vaccines from that. Well, in homeopathy, we use even smaller doses, considerably smaller doses. And we don't then inject it into the person. And that's part of the problem, injecting a pathogen into a person's both, through their arm and soft tissue and bloodstream. And And in fact, many of the flu vaccines even do still include mercury. The problem is not just the pathogen. The problem is more the adjunctive agents. And mercury is put in there, like sometimes aluminum is put in vaccines. Because what's meant by an adjuvant is that it's such a poison that it causes the immune system to inflame. And the fact that Big Pharma is trying to not admit that these mercury and aluminum aren't dangerous to our immune system is just so disingenuous. And the good news is that our body's immune system is strong enough that most of us can withhold and withstand these injections of these vaccines, and that's great. But there's always certain people, and we don't yet have a system of knowing which people, and their lives are literally changed. And so it's not that it causes it with everyone. It certainly doesn't. I mean, smoking, as bad as that is for you, doesn't kill everybody. I mean, not everyone gets lung cancer with it. Not even gets high blood pressure from it. So in homeopathy, we use much smaller and safer doses, first of all. And then secondly, homeopathy is mostly a system of treating people who are already sick. So there are a variety of homeopathic medicines we give to people, let's say, with the flu. And one of them is a flu medicine that has come from Europe. And it has the world's worst name. It's like 18 letters long, oscillococcinum. I mean, if you ever want to make a name of a medicine that few people can pronounce, let alone spell, this is not good marketing. But in homeopathy, it's not the marketing that works, it's the medicine that works. And what is actually, believe it or not, it's a nanodose, a very small dose, of the heart and liver of a duck. Now, you might say, what does that have to do with the flu? Well, according to biologists, ducks carry in their digestive tract every known influenza virus.
That's fascinating.
So what you're getting then is nanodoses of that virus and of some of the different immune processes that the ducks have created to help defend against it, because ducks don't get the flu. And yet, ironically, if a flu virus gets into a chicken, 100% of chickens die. And even though ducks and chickens are both, a type of bird. And in fact, whenever you've heard of the bird flu, it's usually from ducks who migrate from one part of the world to another. And oscillococcinum is so highly diluted, it's diluted 1 to 100, 200 times. So after they do this, and they drop it onto alcohol, and then they drop the alcohol onto the sucrose or lactose granules, and that's what the little white pills are that exist when you buy a homeopathic medicine in a health food store or a pharmacy. And I should mention that 4 different studies have been conducted showing that oscillococcinum is effective for treating people with the flu.
That's actually 4 more studies than vaccinations have behind them, I believe.
well, no, there's more than that. But in fact, what is true is vaccines, and the flu vaccine is notoriously questionably effective. I mean, it's quite common over the last several years for it to be only about 20% effective. And the fact that they're choosing to make this mandatory for some students or health or medical professionals is really just shows you how much political power Big Pharma has. Absolutely. I mean, if they can actually own the media, they can actually own politicians. And, there's a good reason why when you watch the nightly news, there's so many drug ads. The drug companies want to own the information that your people are hearing.
Absolutely. Yeah, and it's fascinating then that you have something so simple as, I'm not even going to try to say the name. I call it just Big O, instead of saying the 18-letter word.
Yeah. Or people commonly call it Oscillo.
Exactly. So it is fascinating that by taking that, then you can then gain pretty much every possible strain. And also what you're doing is that you're not injecting yourself with like mercury or aluminum or formaldehyde or other adjuvants that really can land anywhere in your neurological system and block receptors and block hormone system and trigger autoimmune conditions and so forth and so on. So how should people that are then nervous for their children getting a flu, what would be the best way to take this homeopathic, and how often and when and how long and so forth?
We're talking about the influenzinum?
Yes.
Okay, there's a specific protocol that I've been educating people about that has been very popular in Europe. And they use the 9C potency of influenzinum. And you take 5 doses over a 2-month period. And what it is this one dose a week for 4 weeks. And you take the 5th dose then 4 weeks later. And, to be honest, I've been selling this protocol for about 10 years. And the last couple of years, I've been writing to my customers who have purchased it and asking them and sending several emails because I know not everyone reads an email, but to several to see if they actually got the flu. And it's amazing how few people get the flu and how many people tell us that, well, I used to get the flu. This does seem to help people. So God bless it. Whatever works. The most famous words around medicine are those Hippocratic words of first do no harm. And here's where homeopathy really stands out amongst all systems of medicines is that it's so much safer than conventional medicine. And I want to make it clear, I'm not against all conventional medicines. I'm concerned about certain ones for sure. But, in fact, in my practice, I call my practice adjunctive homeopathic treatment. So it's in addition to whatever else you're doing in your life, both the self-care that you're doing and the medical care that you're doing, and if appropriate acupuncture or herbal medicine that you're doing either on your own or with other health or medical professionals. And because I see most of my patients these days via Skype or some of the programs that are available for free on the computer, like WhatsApp or Zoom, or even the telephone I'll use, that works fine in my book, though there are certain benefits to using some of these computer programs because then I can actually see you. And sometimes that is helpful.
We're going
It really is a pleasure, and I really feel like I'm a clinician of the future because it's wonderful to be able just to talk to someone over the phone and then mail them the medicine so they get it within, a day or two.
It's amazing what technology has brought the world closer. We're going to take a quick break. You're listening to HealthMade Radio. I'm here with Dr. Dana Ullman. Welcome back to HealthMade Radio. I'm Dr. Michael Karlfeldt. I'm here with Dr. Dana Ullman. He's one of the leading experts here in the United States in regards to homeopathy. So you were talking about homeopathy then being an adjunct to other therapies. Do they, and that's always my question, do they play well with herbal medicine, with pharmaceutical medicine? Because with homeopathy, you're always looking to see what are the changes. I'm giving you this remedy, and then you're observing what kind of changes. And if you're doing other therapies, does that not interfere then with the picture?
Well, what is true, when a person is on some conventional medication, whether it be a painkiller or whatever, it changes the person's symptoms. Sometimes they disappear entirely. It doesn't mean that they go away. Many of these painkillers just means that your brain isn't making your conscious awareness not aware of the fact that you have this particular problem. But all too often, like I've said before, is that it doesn't just palliate, it actually suppresses. And so, and therefore, it even masks the symptoms. So sometimes that does make finding the correct remedy more difficult, and that is true. At the same time, sometimes people will, of course, use different supplements and herbs, and the difference there is those provide nourishment and are sometimes able to at least provide some degree of relief so that the body's own defenses can then take over and finish the process and bless the body and mind for doing that. So, homeopathy can and is commonly used along with their different natural therapies. For people out there that are familiar with the broad field of naturopathic medicine, there are 4 naturopathic medical schools in America today, one in the Seattle area, one in the Portland area, one in San Diego, California, and one in near Scottsdale, Arizona. And they're licensed in almost like 30 states, and that is a great profession to go to. About, somewhere between 20 and 30% of the students that go to these naturopathic schools specialize in homeopathy. Others specialize in nutrition and botanical medicine. Others specialize in acupuncture. Others specialize in what's called physical medicine, in terms of, some of the physical therapy and chiropractic manipulation that gets done. And so these schools of naturopathic medicine, to me, are some of the medical schools of the future, because this is the type of care that families really benefit from, that children really benefit from, and that the elderly really can benefit from, because all too often, as we age, doctors too often load our elders with more and more medicines, and it's no wonder that dementia is becoming more common, because they're literally drugging our elders.
Yeah, I agree actually with all the blood pressure medication to stop the blood from going up to the brain. I mean, you need pressure to bring up the blood, and also all the statins and the impact that it has on the nervous system, and so forth and so on. I mean, it's really atrocious what's going on. Doesn't mean, like you mentioned earlier, that pharmaceutical medicine is not needed. It is very good when it's appropriately used.
Right. And God bless painkillers. I mean, God bless antibiotics. One of the things, speaking of antibiotics, that people don't know is that homeopathy became popular in the 19th century. For the most common, the best explanation for it was the amazing success that homeopathic doctors got in treating people during the various infectious disease epidemics of that era. I'm talking about cholera, scarlet fever, yellow fever, typhoid fever, malaria, influenza, pneumonia. And so these have pathogens in it. But you see, instead of providing an antibiotic or antiviral, what a homeopathic medicine does is it strengthens the person's body's our own immune and defense system, so that the body and mind can then begin to fight some of these infective agents more effectively. And then, by not taking an antibiotic, our digestive tract is working adequately, so that as we begin to develop an appetite again, that we're able to digest the foods and then help to create the resilience so that we don't get reinfected again. I mean, nothing's worse to get an infection, either yourself or your child, and then take a round of antibiotics and it get rid of it. And then 2 weeks later, you develop another ear infection.
Yeah, I see that again and again in my practice, and I know it's the same with other doctors, is that you utilize these powerful pharmaceutical drugs, and yes, they do the job, but they leave the system so weak after, so it has no defense system at all. And I also, not only infectious agents, but then you're dealing with people dealing with cancer. You get rid of the tumor, but the immune system is so weak. So, when you stop the treatment, then the tumor, the cancer can just walk right in again. Yeah, so the key is at the end of the day is to fortify the body and make it strong to do its own job. And I know homeopathy, that's where it shines. It's to bring that intelligence into the body to generate its own healing response.
Right.
And what's really fascinating to me, I mean, going back to vaccination again, and I apologize for that, but people are so afraid of things like mumps, measles, and thinking that they're going to die when there are 5 people that have measles in a state and it's a measles outbreak. And here you have then homeopathy that really shine. I mean, it's shown when people were dealing with the worst possible infectious diseases back in the 1800s, 1900s, and it did a great job for those things. Then how I mean, what it can do just for plain things like measles.
Right.
Yeah. It's
well, by the way, here's the other thing that people really will benefit to know about measles. There was a study done in a major cardiology journal that showed that in Japan, when they looked at people who were older and who got a heart attack, they were more likely to survive the heart attack if, as a child, they got mumps or the measles. You see, once again, for those of us that believe in evolution, those childhood illnesses are important parts of our evolution to help strengthen our cardiovascular system and our immune system.
Yeah.
These childhood illnesses are part of our evolutionary development. And by taking away those opportunities to have those diseases, we are weaker and we are more vulnerable to chronic diseases that kill us.
Yeah, it's like helping the chicken out of the egg, so that it doesn't it doesn't develop its own strength to survive the world.
That's right.
Yeah.
You see, I have a basic theory that goes way beyond medicine, but whenever we do something to and for a person, they don't learn to do it themselves as well. And so that's the way the immune system works, too. And so we have to respect the body's own immune system, and homeopathy is one system of doing that. Because if you think about it, like I said, the whole system is based on looking for a medicine that will mimic the body's own defenses, not to suppress them.
So if we're going to demystify homeopathy, because like you said, there are 1,000 different remedies, and then in addition to being so many different remedies, you also have all these different potencies. So where you have M potency, C potency, and how does a lay person navigate all of that? What does it mean an M potency, 300C versus 3C, or
right.
How do you navigate all of that?
Okay, well, it's really very simple. X potencies, X is a Roman numeral of 10. That means it was diluted 1 to 10, 3 times or 6 times or 12 times or 30 times. C is a Roman numeral also that stands for centesimal, which means 100. So that means it was diluted 1 to 100, 3 times or 6 times or 12 times or 30 times or whatever. Then when you see 200, it will say 200X or 200C. Now, the only thing that gets tricky is that when you dilute things 1 to 100, 1,000 times, the Roman numeral for 1,000 is M, which stands for millesimal. And so when you see on a bottle 1M, that means it was diluted 1 to 100, 1,000 times.
So what is better then? I mean, to have a M, is that a stronger substance?
Yeah. You see, we find that the more a substance is diluted and shaken, the stronger it acts, the deeper it acts, and the less doses are needed.
So with that then, do you, when you say less dosage, should you just take it one time and then see what happens, or should you repeat?
Well, all that is sort of complicated. I I don't want to get into this on this short interview.
No.
But basically, people that are new to homeopathy should not use the M potencies at all, or even the 200th potencies. The most common potencies that people that are new to homeopathy should use is the 6th potency, the 12th potency, and the 30th potency. And then, and then I usually just tell people, use whatever potency you have available, first of all. And then secondly, if you have a choice, use a 30th potency if you're more confident in the prescription of the remedy based on the whatever knowledge you have. So it's more based on your confidence than anything else.
Okay, and that is X potency, C potency, or when you're talking about the 30, or it doesn't matter.
Well, a 30 is X or C, and there really isn't a big difference between the two.
Okay. And actually, let's take a little quick break so we can chat a little bit more about this, because I want to help the people out there to demystify homeopathy and just kind of make it a little bit more simple. You're listening to HealthMade Radio. Dr. Michael Karlfeldt. I'm here with Dr. Dana Ullman. We'll be right back. Welcome back to HealthMade Radio. I'm here discussing homeopathy with Dr. Dana Ullman. I know homeopathy is such a powerful medicine, and sometimes I know for lay people it's a little bit challenging to figure out what to do when and so forth, and how many to take and how many times during the day, and well, it's also a little confusing because each of our medicines, the name of them is based on their Latin name, so that we can be very specific about whatever plant, mineral, or animal or chemical we're using. So that is a nomenclature that's used throughout the world. So I realize that is a little bit of off-putting. The fact that you'd see arsenicum album and you go, arsenic, is that what that is? And in fact, that is what it is. And we even do use homeopathic doses of mercury. But the FDA, of course, doesn't allow us to use doses of these toxic substances except when they're diluted so much that they are extremely confident that this is not a toxic dose. But they're more than willing to inject it into somebody's blood.
Yeah.
Okay.
Something like that.
Yeah. So what is let's pick a normal disease that you see quite often. Let's say high blood pressure, for instance. I mean, what would be something that would be good for somebody dealing with high blood pressure?
Well, you see, there's hundreds of substances that can and will raise a person's blood pressure. And there's hundreds of different reasons that people have high blood pressure. It's not just salt in the diet. It's not just fat in the diet, and it's not just stress. I mean, we all have. There's a whole variety of genetic influences. There's a whole variety of psychosomatic issues that get raised. But in fact, back to the thing about salt. Homeopathic doses of salt are actually one of our really common and very important medicines that we use in homeopathy. But not even just for high blood pressure. It deals with a whole variety of ailments, including, believe it or not, homeopathic doses of salt happens to be one of the leading remedies we give to people who have a depressive state.
Oh.
And if you think about it, what is that ingredient that is so obvious and prominent in a very tier that we have? It's salt. And that's not just by happenstance. Even though I'm a nice Jewish guy, I don't quote the Bible very much, but there is that story from the Bible of Lot turning around and seeing his wife, and it was that he turns into a pillar of salt, or she does. But that's what happens when you dwell in the past. You get crystallized. And that's a homeopathic dose of salt can and will reduce the degree of depression that people have. And because salt is also linked to high blood pressure, that is also one of the many remedies. So, I mean, if you have high blood pressure, don't go out to a health food store and get homeopathic doses of salt, which, by the way, I mean, just so I can clarify, the Latin name for salt is what's called natrum mur. Natrum is sodium, and muriaticum is the chloride part. So that's what that is.
So it isn't that, well, I know homeopathy is, I mean, it's a very studied, very methodical science. So what are some of the things that you see out there that people are going towards pharmaceutical medications for, where they could then easily just go to the health food store to pick up a homeopathic remedy, and what would be some good examples?
Well, we have some great things for allergies. We have some great things for injuries. I mean, I know we've all heard of arnica before, hopefully. But the other thing that's also really important, the remedy that I use more for injuries than arnica, is a medicine called Rhus tox. Rhus is R-H-U-S, and the second word begins with T-O-X. And believe it or not, that's homeopathic doses of poison ivy. And now poison ivy, we know, causes skin rashes. And in fact, we use homeopathic doses of poison ivy for certain skin rashes that itch, especially when you scratch them. They get worse. But actually, if you were to ever take poison ivy or poison oak internally, one of the symptoms that it is known to cause is this effect upon our connective tissue that creates what's called the rusty gate syndrome. What's the rusty gate syndrome is you know how when you either get a sprain or you just feel achy, and when you initially get up, you feel really stiff like a tin man, but then the more you move around, the more limber you get. So that's what we call the rusty gate syndrome. Where you open and close the gate a little bit, it loosens up a little bit. And the same thing with our body sometimes. But, for certain backaches, I use this Rhus tox in the 30th potency. Sometimes after overdoing certain things, I use Rhus tox, 30th potency. And, that's really great stuff.
And how would you administer that? You said that they come in little pills, little sugar pills. So how many do you take? How often do you take them? What is kind of a common scenario if you're just a lay person out there?
Yeah. Well, you take them as needed. In other words, the more pain you're in, the more frequently you'll take it. So, I mean, if you're only in really light pain, you might only take, a single dose or maybe a couple doses. But then the more serious it is, you might take it, between 3 and 6 times a day, maybe even more at first. You might take it every hour initially, and then you notice, well, it's not as bad, and so you could do it every 2 or 3 or 4 hours. I always like taking some a medicine just before going to sleep, because that we do so much of our own healing during this sleep cycle, and so taking some just before going to bed, I think, is very helpful.
And you have that where you don't mix homeopathy with other things, meaning that you can't do it like with peppermint, and you can't do it with things that are strong. Is that correct?
Well, there's some myths about that. What we do try and do is we do try and separate out some of the stronger treatments and stronger scents from the homeopathics, just to make certain that there isn't a problem. But, we don't go crazy about it. And so, sometimes the French people say that mint is a problem. Other people say it's not really that much of a problem. So, there are different and controversial subjects as to what works or doesn't work.
So, because a lot of people, let's say, they're on a complex, nutritional regimen, and they're trying to figure out when to take what. I mean, it would be okay for them then to take the homeopathic remedies at the same time as a take the herbal medicine or whatever it may be.
Yeah, it is generally fine to do that.
Okay, great. And then you also have this thing about what's called Herring's Law, where...
Right.
Because people, let's say they are dealing with depression and they take a homeopathic remedy, let's say they do the salt remedy, and then all of a sudden they develop a skin rash, but the depression is better. So does that mean that is a bad remedy because it causes skin rash?
No, it means it's a good remedy, because whenever you get a skin rash, that is an externalization of an internal process. And here you have a person having depression, and that's better. So it's these what we find in what's part of Herring's Law of Cure is the observation is that the more serious and deep diseases get some relief, where some of the superficial ones get worse. So be a good sign of a homeopathic medicine providing some benefit.
So it's that notion kind of inside and out, meaning that it's better to heal the psyche and then get a physiological symptom, because the physiological is kind of on its way out, rather than making it more acute versus chronic, like you were talking about before.
And the other thing that's important is sometimes we re-experience old symptoms that we had in the past, and that's another sign of it being the right remedy, and that there is a healing going on. And also is a really good sign that this isn't a placebo effect, because people usually, when they have a placebo effect, don't get worse first. They simply get better. So that's a really nice sign of it too.
And so when they get then that skin rash, I mean, the best thing to do is to allow it to work its way out, rather than try to put steroids on it and try to kind of calm the rash down, correct?
Yeah.
Okay, good. So if there's a number of remedies, that you feel that pretty much everyone should have in their cabinet, if there's like your top 5 ones or 6 ones, what would they be?
Okay. Well, everyone will have their own different ones, but arnica is in there. Rustox, to me, is definitely in there. There's a medicine called Nux vomica, which is an important one for certain digestive problems from either overeating or over-drinking or overdoing things. That's a really good one. And, if you have allergies and you're a child, probably pulsatilla is a key one, and pulsatilla is also a great one for many women who are real emotional and who wear their heart on their sleeves, and from there's so many other possible ones. It's sort of hard to limit it. But,
it's hard. I'm sure you fall in love with a new one every every time.
Yeah, you do.
Yeah, I know that is, and I tend to circle back to remedies I used 30 years ago, and I think, why did I stop using this one as much? And you fall in love with it again. So, a last question, because can homeopathy, deal with things that are very complex and very, things like cancer or Lyme or MS, or can homeopathy be part of that solution effectively?
Yes, part of it. Yes, we see this, quite regularly. And this is the type of thing that you need to go to a professional homeopath for.
Absolutely.
This is not something you're going to learn to treat yourself for.
No.
But homeopathies, absolutely can and should be considered as a part of the mix there.
Wonderful. Well, Dr. Dana Ullman, I truly appreciate you having on the show and taking a moment to try to demystify homeopathy, because it's such a powerful type of of medicine, and I really would like people to use it to its fullest, and don't be afraid of it, because it is, like you said, first do no harm, and homeopathy is all about that.
That's right. That's right. And for those people that are looking for a professional homeopath and you don't have one in your area, I mean, feel free to look me up. My website's at homeopathic.com. So that's an easy one. That's the normal Americanized spelling of homeopathic, HOMEOPATHIC. Or you can also look me up. My name is Dana, Dana Ullman, Ullman, and I'm in Berkeley, California. But, because I've written 10 books and hundreds of articles, if you were to even do the word homeopathy and the word Dana, it'll come up with my name at the top of the thing. And my website has 100 free articles, and I've written a bunch of articles on a whole bunch of other sites. So it's all, I do whatever I can. This is not just my job. This is much, much more than all that.
And I can tell. I mean, like in the beginning when it just went on and on and on. I mean, this is not just something that you do as a job. This is something that you do as a life calling. It's who you are. I would really urge all the listeners, if you feel that homeopathy is something that would fit with what you're dealing with, which I don't see why it wouldn't, because it's such an amazing type of therapy, reach out to Dr. Dana Ullman. And all the resources that he has available, all the information, it's all there. Thank you so much.
All right. My pleasure. My best to everyone out there.
Thank you so much. That is
Bye-bye.
it for today. You're listening to HealthMade Radio. Remember, check us out at healthmade.co. Health is what you make it.